There's a survey in India which says 10% people, 11% people have mental health disorders, which does not include alcohol and smoking. If you include that, the number rises to 22%. Mental health is necessary for everyone, not just for a few people who are unwell. सुस्ती रहता है, ये तो depressed ही है, ये तो उदास ही रहता है, ये तो obsessive है, is a way of isolating people and stigmatizing them further.
Is there lack of awareness? इसीलिए डॉक्टर के पास नहीं जाते?
National Mental Health Survey in 2015-16 done by in 6-7 states, जहाँ पे we are saying 75% people do not have access to mental health services.
Anybody who says that I think there is something wrong with me in the family, the fear is the pushback that तू mental है क्या, तू psycho है क्या?
There are 3 myths. Psychiatric दवाइयाँ lifetime चलती हैं, psychiatric दवाइयाँ sedatives होती हैं और addictive होती हैं, और जिसको भी psychiatric disorder होती है वो पागल हो गया. अब जो एक और चीज़ हो रही है, which is the glamorization, the TikTokization of mental health, quick solution to a quick problem. Mental health does not have quick solutions.
By the time you're 40 in these corporate jobs, you're already burnt out. So what are the red flags that young professionals should watch out?
40 is too late.
Too late already?
Too late already, because people are having a quarter life crisis. People are having existential worries about what are they doing at 25 now.
Namaste, Jai Hind. You're watching or listening to another edition of the ANI podcast with Smita Prakash. Today in our studio is a psychiatrist with over 30 years experience who'll answer our questions on all kinds of mental anxiety issues. Dr. Achal Bhagat holds MBBS, MD and MRCP degrees. Dr. Bhagat is also known for treating conditions like autism, dyslexia, eating disorders, mood disorders and post-traumatic stress disorder or PTSD. My colleague Shalini Bhardwaj joins me in this conversation. Thank you, Dr. Bhagat, for being part of the podcast. We have, Shalini and I have a number of questions which I want to ask. We want to ask you. But first, just before we start with, the complex issues which we want to discuss, I want you to first break down to me these terms so that when you use them in the podcast, we know. Like, what is the difference between a psychiatrist, a psychologist, a therapist, and does one have to first go to a therapist, then a psychologist, then a psychiatrist? How do we know the difference between all this for a layman?
So, thank you for having me over. Let me take a step further back.
Ji.
Let's see what are mental health needs, what are mental health problems, and what are mental illnesses. Because people confuse that. There is a lot of talk about mental health, but people don't know what is mental health. So mental health is a search for a journey for one's dignity, having a purposeful life, having a life with a sense of belonging, having a life with a sense of control over oneself, and having experiences which nurture these factors. Right? So all of us have mental health needs. But all of us are not able to fulfill our mental health needs because all of us are pushed away from these goals to suffering, sometimes lack of dignity, sometimes experiences of isolation, sometimes sometimes experiences of powerlessness and helplessness. And these are everyday experiences that we have. So it's a journey. And it is a journey that we can facilitate for ourselves. So mental health is necessary for everyone, not just for a few people who are unwell. Then there are people who live in circumstances which can create mental health problems. For example, there will be students who are trying to prepare for exams. There would be people who face COVID. There would be people who have had other difficult circumstances, may have experienced violence or abuse in their lives. There might be people who are facing, in the sociological context, discrimination. So there would be a number of things that could precipitate mental health problems.
Right.
These mental health problems would reflect themselves in processes of thinking, processes of feeling, the way we think, the way we feel, the way we act out, the way we relate to people. But they do not amount to a diagnosis of a disorder.
Okay.
Then there'll be some disorders which are specific defined कि this ये cluster of symptoms होगा तो ये disorder होगा, right? Anxiety, depression, obsessive compulsive disorder, bipolar mood disorder. So there are about 200 such disorders. People, club mental illnesses as one
जी.
and then stigmatize them. So what I'm trying to say is that mental health needs सबकी हैं, mental health problems सबको होती हैं, vulnerabilities
varying degrees.
circumstances, difficult circumstances सबको होते हैं. Sometimes when stress, vulnerability come together, biological vulnerability, sociological vulnerability, psychological vulnerability, when they all come together, it may come through as a disorder.
Okay.
Now, when it comes through as a disorder, so mental health needs for everyone, mental health problems, 40 to 60% people in a population might have mental health problems at any given point of time, which do not amount to a diagnosis of disorder. Then there will be between 1 to 5 to 1 to 8 people in a population who have mental health disorders. It's a huge number. I give a range because some surveys will say 1 in 5, some surveys will say 1 in 8, some surveys will call.
You're talking about India or global?
I'm talking about global and India.
Okay.
There's a survey in India which says 10% people, 11% people have mental health disorders, which does not include alcohol and smoking. If you include that, the number rises to 22%. So it's as huge as that.
You're talking about millions, that means.
You're talking about millions. And then most of people do not get help.
Sure.
So these distinctions of psychiatrists, psychologists, therapists, counselors are distinctions that happen largely on Twitter or X or, in our middle class conversation where there is some access to services.
True.
70%, 80% people do not have any access to services.
Yeah.
And are reliant on local, cultural, subcultural methods of seeking support, families providing support, the illness being festered for a very long time because of stigma, because no help is available.
Yeah.
Because the general practitioner may not, even if they diagnose it, they might treat it inadequately. So a psychiatrist is a medical doctor trained in a specialization of psychiatry, has done MD in psychiatry or further qualified in DM, super specialized after that. And they diagnose, assess, treat and monitor the treatment of psychiatric disorders. But they also, because the mental health needs are so high, they also fulfill needs of people who have mental health problems as well. They work both through medicines, neuromodulation, like magnetic stimulation of the brain, or through psychological treatments. So psychiatrists could be trained in psychological therapies as well.
Okay.
Then there are people who provide only talking cures. Right? They do not prescribe medicines. Out of these, the words that you'll find is psychologists, therapists, counselors, coaches. So there will be a number of range of people who are providing and self-styled gurus.
Yes.
So and they actually
the gurus used to be the traditional people that families took their problem child to or whatever.
Even today, I think the subcultural method of dealing with mental health needs is being fulfilled more by the non-mental health professionals than the mental health professionals, because there's more faith, more trust. The vocabulary matches, the narrative matches somehow. And because the narrative matches, you seek out help from people whom you traditionally have used to seek out help for. Unfortunately, what that does is that sometimes it delays the seeking of help if there's a disorder. So a psychologist is trained in the science of working on looking at patterns of behaviors, feelings and thoughts and helping people recognize those patterns through various methods by forming a therapeutic relationship and helping them learn different ways of addressing, either acknowledging, accepting those patterns, feelings and thoughts, or helping them learn methods of adapting to them or changing those patterns.
You bring a very important point: accepting and acknowledging that
And
there's
adapting and changing. This
adapting
is not
and
just change.
Yeah.
Sometimes the focus on change is so much that we forget that the biggest element of therapy is acceptance. That you accept something is happening which is not helpful for me, and I need to do something about it that I can do something about. I can't wait for the context to change.
Yeah.
Because in mental health, there is the person, there is the problem, and there is the context. Sometimes we end up fighting the context so much. And I'm not saying the context is not real. Sometimes the context is as real as you've faced violence for years.
Yeah.
And that context needs to change. But you also have to recognize that you're resilient and you can bring about that change.
That resilience is also sometimes negative, in the sense that you tend to find reasons why you are in a particular manner. For example, you talked about domestic violence or violence of any nature. It could be a child being violated in school or in being bullied. And if that child comes to the parent's natural reflexes would, in many cases, is that हमको तो भी तो स्कूल में मारते थे, हम देखो कैसे सीधा हो गए, हमको तो कोई फर्क नहीं पड़ा. Subsequently, the child then gets a reflex mechanism that there's no point telling my mother if I'm getting bullied.
ये जो होता है ना कि the society normalizes violence,
Yes,
or abuse or othering or discrimination. There is a significant amount of normalization that happens that actually blames the person who's going through the process of violence. Right?
Yes.
So, of course, there is a whole thing that we can talk about violence and mental health.
Yes.
So, for example, if we talk about the number of...
I was just basically coming to the thing about accepting that and acknowledging that there is an issue. And once there is an issue, one way of dealing with it is, the first step to deal with it is stop the violence in whatever manner. If it's spousal violence, whatever violence,
sometimes
get
when you're
out
in
of
the
it.
cycle of violence,
You
it's very
can't.
difficult to recognize
Right.
that you end up blaming yourself. And not to blame yourself is an acceptance as well.
So the two things should happen, right? One is to deal with the person who's being violent or the thing, and the other one is to set me thinking about the rights and wrongs of violence.
There was a
right?
campaign, awareness campaign many years ago. I'm sure you'll remember it. It was called the Bell Bajao campaign.
Yes.
Right?
Yeah.
I think Bell Bajani is zaruri. On violence and abuse, we have to all talk about it. We all have to, call it out and draw a boundary.
And also there's this, I think the international sign or something of muthi aise karne ke liye, like suppose, and it's like a woman sitting in a bus with her husband who's violent, but she can't say that he's the violent man, and she can just raise her fist, and it's a signal to the others that save me.
And there could be many such methods.
Methods, yes.
So, to bring back the connection between violence and mental health, just as just to see how context influences mental health. We could do the same on unemployment. We could do the same on poverty.
Yes.
We could do the same on educational processes and stress and mental health. Farmers' suicide. We could see the link between the context and the ultimate mental health problem for many such issues. But double the number of women die by suicide in India than any other country. Double the number. One is because of the actual numbers, but the fact is that the number of people facing violence and abuse in the country is also very high, right? The lack of access. So the moment you become disempowered in one way, the number of people men are able to access mental health services more so than women.
Really?
Because
access to funds, is it because of that?
Decision making and funds about health
is still with the man of the
somebody
house.
might travel from Bihar to Delhi to seek mental health services or health services, but if you're a woman, that decision may not lie with you because the agency has been taken away from you. So not only are you living with the mental illness, living with the violence, but also you can't access resources for support on the same.
All she can do in many cases is to speak to her parents, which is considered a therapy in itself in many places. That send her मायके भेज दो, वो जो भी डिप्रेशन है ठीक हो जाएगा.
वो फिर उसके राइट्स के खिलाफ है ना. उसको ये कहना कि वो कि ठीक होके आ जाओ, वॉशिंग मशीन में भेज दिया, आप वॉशिंग मशीन से धो के आ जाओ.
I'm not saying it's right, but I'm saying many cases वही होता है.
वो एक सेफ्टी नेट है जिसको यूज किया जा सकता है. बट यूजिंग so the law says that the woman has the right to stay where she is staying because that's her home as well. And it's the perpetrator who has to be removed from that place. But again, we are moving away from the core issue of mental health because...
But I am coming to this simply because when you're talking about कि access नहीं है, the other thing which happens is उसको मैके को भेज दो, वो ठीक हो जाएगी. And then the parents there, when she goes there, in many cases they see it as... आ गई है, चलो बच्चा नहीं हुआ शायद इसलिए डिप्रेस्ड है, बाबा के पास ले जाओ, वो बता देंगे क्या हुआ है.
नहीं तो 2 थप्पड़ मारता है, 2 थप्पड़ में क्या होता है. हाँ. मतलब वैसे तो अच्छा है ना.
They don't give that importance.
दिल का अच्छा है.
दिल मतलब देखो कितना ख्याल रखता है. तो बट वो the negation of the person's narrative then is equal to the negation of the person.
So do you feel in this respect that there isn't enough awareness that I mean before one goes to a counselor or a therapist or anybody, whoever is your support structure, जिसके पास भी आप जाएंगे, पहले you, as you said, acknowledge and accept. Is there lack of awareness, इसीलिए डॉक्टर के पास नहीं जाते?
और स्टिग्मा है और लैक ऑफ रिसोर्सेज है. मेंटल हेल्थ रिसोर्सेज कहाँ है? See, our own surveys, there's a national mental health survey in 2015-16 done by in 6-7 states, जहाँ पे we are saying 75% people do not have access to mental health services.
True.
Right? The human resource shortages are there. Who provides the mental health service? And then most of the mental health professionals are trained in a medical model of the illness as opposed to a psychosocial, biopsychosocial model of the illness. That there's a matrix of causes, right? Causes a mental health problem, right? And ultimately, as a doctor, you with 40 people sitting outside your OPD or 100 people if you're in the government sector.
You have 15 minutes or 20 minutes a
you
patient.
Have 3 to
Max.
10 minutes with the patient, and then you're trying to say, okay, I have to address this, I have to address this. So you do the easiest job, come to a diagnosis, prescribe a medicine and move on.
Yeah.
Because at least kuch to farak padega. It's well-meaning, but it also, somebody has worked very hard to get to your door.
Yeah.
Right? For them, it does not matter that you're a psychiatrist, psychologist, counselor, therapist, whatever name you might give.
Dr. Babu.
You are the solution provider.
Yeah.
And you are their only hope, who they feel would understand what is the impact of what is happening in their life. It might be because of neurochemical changes in their brain. It might be because of stress due to a narrowly defined success by their parents. It might be because of an examination system that has paper leaks or is rigid. It might be because of discrimination faced on the basis of culture or caste or zillion. It might be because of your experiences that you've had because of 100 things, but it's affecting your thoughts and feelings and the way you are interacting.
But they've been brave enough to come to the doctor,
right?
But the doctor probably goes through the medication route because he has only 10 or 15 minutes, or maybe less than 10 minutes.
So in that tone, we end up blaming the service provider.
We don't actually.
Because
that's just it.
As a service provider, I can tell you, I'm an informed service provider, right? I know the issues of violence. I know the issues of the context. But the reality is that in all the time that I have to educate the patient about the nature of their problem, about where it originates from, how I have to offer hope.
Yeah.
I have to make sure that they're compliant with the treatment. In all that, I have to do that. And in Delhi, there are not more than 300 psychiatrists for the whole of Delhi.
The population.
This is the major issue.
But let me tell you, Doc, like suppose I have a sibling who has a mental disorder or who I think has a mental disorder, has not figured it out, but I feel that there is a maybe slipping into depression or something, and I have to convince my parents that there is my brother or my sister is facing a lot of tension, needs to see a doctor if there is an issue or not. अब पहले पेरेंट्स को कन्विंस करो, फिर सिबलिंग को कन्विंस करो भाई कि यू हैव टू गो, भाई यू हैव टू शो योरसेल्फ टू अ डॉक्टर. अब उनको लेके जाओ. नाउ इन ऑल पॉसिबिलिटी द डॉक्टर डजंट गिव अ मेडिकेशन एंड tells that person how she can sleep and how she should reduce that and all that, and she comes back home and she tells the parents that फजूल में तो स्मिता ने भेजा मेरे को डॉक्टर के पास, डॉक्टर ने तो बोला कि 8 घंटे सो जाओ तुम ठीक हो जाओगी, कुछ प्रॉब्लम नहीं है. एंड देन पेरेंट्स विल गेट आफ्टर मी कि अरे you said that ये तो साइको है, ये मेंटल है, ये do you know the terms? ये ऐसी है, उसको तुमने मेंटल कर दिया, उसकी तो शादी भी नहीं होगी अब.
So एक तो
look at the whole.
So एक तो इस माइक्रोकॉज्म को एड्रेस कैसे करना है उसको बात
करें. And next time I feel like that, then I will not go to the doctor because I know what has happened.
So एक तो ये माइक्रोकॉज्म जो एनेक्डोट है उसको एड्रेस कैसे करना है उसको बात करते हैं. That's useful because by using that as an example, one
I'm just simplifying it.
Yeah. But one has to understand that there are roots to this anecdote, right? And those roots come from two assumptions that are society. And I want to address the roots first and then come to the solutions for the example that you've taken. The roots come from two assumptions about mental illness. One is that people with mental health problems are dangerous. And the second assumption the society is making is that the people with mental illness or people living with mental illness are incapable of taking their own decisions.
Correct.
Right? This coupled with a complete lack of information, there are three myths. Psychiatric दवाइयाँ lifetime चलती हैं, psychiatric दवाइयाँ sedatives होती हैं और addictive होती हैं, और जिसको भी psychiatric disorder होती है वो पागल हो गया. He's of or she's of unsound mind. These three myths and those two assumptions are pushing people away from mental health. अब जो एक और चीज़ हो रही है, which is the glamorization, the TikTokization of mental health, quick solution to a quick problem. Mental health does not have quick solutions. You can't solve mental health in 10 tips for ADHD. You can't solve mental health in. You have to understand what has got you where you are and how do you go from here to the next step in your life. Seeking mental health, addressing the mental health issue is a positive experience because it does turn life around. It is something that helps you reclaim your life for yourself. So if we are able to change the narrative to a reclaiming of life, to functionality, and maybe not productiveness, not everybody has to be productive in their life, but to be happy within yourselves, to be having a good quality of life, to be able to accept oneself, to be at peace with oneself. If those were the narratives that we were able to generate, and those were the testimonials that we were able to generate from accessible role models. One actress saying in one TV interview, or 5 now saying in 5 reels that they have a mental health problem, actually does not solve the problem because they had access to resources. So it started conversations, but it is also glamorizing seeking help for mental health.
Okay, I have mixed feelings about that. I just feel that when so-called successful people, in the sense those who've had material success, and they tell us that they have gone through, mental disorders and they sought help, it somehow starts a conversation at home. At least I can, because the thing is, अमीर लोगों को क्या mental disorder
The number
हो
of
सकता है?
times I've used such examples is innumerable.
Okay.
But I'm not saying that people should not disclose. I'm saying we need more accessible people, creating an environment of conversation, accessible people, even more accessible than you and I, right? I'm not talking about, so quote unquote, if a captain of the cricket team says, I went through a low,
Yeah.
it helps. But what helps more if the principal of a school also says so. That kuch nahi hota. I also went through a mental health
But
problem.
look at if a Virat Kohli says that he was under tremendous stress, and whether it was religion or whether it was a pat on the back by a colleague when Dhoni called him up, and or whoever spoke to him, and he realized that there is an issue and I have to deal with it, or when Deepika Padukone says it, then what happens is that you're getting more and more people to discuss it rather than principal of modern school who will speak about it.
So I'm saying starting conversations in communities around mental health is very important. And that's why I welcome the mention of mental health in the economic survey last evening. Right? At least it's being said that mental health is important for this country.
Yeah.
It is not being seen as a cherry on the cake. It's
That,
not being
in
seen.
fact, Shalini wanted to speak to you about
first time they have highlighted
on
this.
the Kota issue also you wanted to speak about, right?
Yeah. Sir, I just wanted to know, everybody is aware about the suicidal cases of Kota. Why this is happening? Why so many students are...
So कोटा पे फोकस इसलिए है क्योंकि वो न्यूज़पेपर में आ जाता है. The reality is that the dying by suicide in India is increasing, and a significant number of young men and women more are attempting to die by suicide and are completing that process. The context of that, the educational context of that is one context of that. Kota is one context of that. It comes from a very narrow definition of success. It's not happening today. It's been happening for years. In 1995, when I came back to this country to start working in India again, one of the first things that I did was to start a helpline called Operation Hope, which was an examination-based helpline. It was one of the first helplines that we started at that point of time. From 1995 to 2003, we ran that helpline because and it was a Delhi-based helpline. The number of suicides in Delhi were increasing at that time. But the context was, सब लोग IIT जाना चाहते थे. IIT जाना बड़ा मुश्किल होता था. People were trying very hard. They were not.
Competition.
In 2001, the social context changed. सब लोग जी के पास जाके call center में काम करना चाहते थे. There was a job available that you could address. There was a plan B, plan C available for you.
Yeah.
You felt hopeful about that plan B, plan C. The number of suicides actually came down. Not because of the helpline, but because of a plan B and plan C. So it is this, if we are going to work, so the way to address the issue of losing young lives is to address the educational system, is to address the employment opportunities, is to make the educational more skill-based so that more livelihood opportunities are available to us. And if you do have a mental health problem, then of course mental health services should be accessible to you. We have the only law in the world, well, one of the only laws in the world, which actually guarantees access to mental health as a right. Health as a right does not come in other laws. But mental health as a right is acknowledged in the Mental Health Care Act. But usko implement karna, the whole process of making sure that there is access to mental health services is important. But changing the educational system, having options in the educational system. For example, this thing about having 2 board exams instead of 1 board exam. For example, if you could choose to take 2 subject exams this year and 1 subject exam in 3 months' time and another subject exam in 4 months' time, it will allow you to have, and having a range of livelihood opportunities would help you decrease the level of stress that the students would have.
Just like they started grade system also. That is also
वो
helpful.
एक tokenism है, मतलब honestly वो एक tokenism है, because the pressure on the student, even a third grade student in this city even a nursery grade
I
student
can
in this
see
city,
that, sir. I can see that.
the
Huge
amount
pressure.
of pressure to
Huge
perform in an educational environment is so huge. So you've lived in that pressure cooker till class grade 12. You lived with the expectation that Kota jaoge, miraculously you will be able to break the system and get into a privileged way of education, as if being in IIT will solve everything for you.
So also these films which come out which glorify the struggles, which is good. I mean, of course, the
Inspirational.
struggles are supposed to be inspirational. But when you talk about the struggles before the UPSC exam, ki absolute difficulty से UPSC exam crack कर लिया, got admission, and that is the passport to success in life. Now, when those films come out, then when the child complains that its life is very hard, cannot take the pressures anymore, parents tend to think, देखो वो कर सकता था, तुम क्यों नहीं कर सके?
मीडिया को थोड़ा सा ज़्यादा ही ब्लेम कर देते हैं. So for example, not many people became gangsters after Diwar came out, So the reality is that it is the microsystem it's the family, it is the parental pressure, it's the school pressure that the society creates, it's the definition of a success that the society creates, which then gets reflected in various form of media, which magnify the stress. But the stress comes from three things. One, young people believe in that narrow definition of success that they've been forced to believe in from a nursery में आपको entrance exam दे रहा है to get into a school, then you're used to taking exams and only wanting to pass them as your only aspect of life that you're focused on. Second, parents think that is the only way to move forward. Now, migration out of your local system into another bigger system becomes a goal. So it's these microsystems, and it's again who becomes our role model. Not everybody will become Sachin Tendulkar or Dhoni.
Yeah.
Right. With the growth of IPL, it's the number of role models has increased.
And also scope, no?
Right.
सिर्फ 11 नहीं है in the country who can make it to your
right.
team.
So
You can have
the
many.
moment you see that as an example,
Yeah.
the moment you increase the opportunity for young people,
Yeah.
the stress goes down. So we have to continue to increase opportunities. At a policy level, we have to increase opportunities. That will create hope.
So you were talking about more women dying by suicide, and then there are students who are doing it, farmers who are doing it, certain groups which are more vulnerable.
Young men are completing more suicides than...
Okay, young men. So when somebody comes to you and when you realize that this person is on the brink of taking that step, how do you deal with it in the sense, are you supposed to inform the family as a doctor? Are you supposed to inform law enforcing authorities? How do you deal with it?
It's a very grey zone. It's a very grey zone. Again, the society has outsourced some of the most difficult tasks to healthcare professionals, right? If somebody is at a point where they're feeling hopeless, then it can't just be a mental health professional who brings them back from the brink. It has to be a societal safety network. So they have to be safe places. They have to be safe places which are not seen as incarcerating places. You have to create safety plans. You have to have a multidisciplinary team approach. You have to have a psychologist, a social worker. You have to involve the family. The family has to be a key stakeholder in helping the person, family or friends. Sometimes the familial relationships are so torn that family may not be the support system.
Yes.
Sometimes there are no familial relationship or no friendly relationships. Then the healthcare systems and the police is given a role in the Mental Health Care Act in being able to support such a person by guiding them. The judicial system has been given a role to be able to help the person who is not willing to seek help, to seek help. So there are a multiple set of methods. But eventually, putting all those into play requires integration and policy that so the suicide prevention strategy, one of the things, for example, patient transport for somebody who is suicidal. For example, emergency triages in the city should be informed about. So, for example, if somebody sitting in, let's say, Mayur Vihar is feeling hopeless and helpless, I should be able to guide them to the nearest hospital, A&E, saying that go there, you'll seek help. It is better than guiding them to the nearest police station.
Yes.
Right? So the general healthcare system has to become more prepared to support. The general education system, for example, should have a child protection officer, should have a counseling service, not a counselor, because one counselor for 3,000 children will only organize events and talks. So if you have to look after the mental health, if you have to become a portal for mental health, for mental health services through educational system, you have to have counseling services. At least one child and adolescent mental health resource center per district, one mobile mental health team.
We are 10 years behind that already?
We are 40 years behind.
40 years behind that.
Right?
Yeah.
So at least we need to start somewhere.
Yeah.
But for example, having mobile mental health teams. And we are not even talking about even more complex situations like homelessness and mental illness.
Yeah.
All this needs to be addressed by a continuum of services, not just by a phone line to prevent something. A phone line can only go this far. A Zoom call can go only this far. The desperation a family feels when they are looking after somebody with a major psychiatric disorder. Even today, I read a news about somebody, a family in Noida, because of the lack of access to mental health care, not being able to survive and being discovered by the neighbors. Every 3 months, 4 months in a national capital,
you're reading about it.
You're reading about such news, which means that either there's stigma or there's a lack of services, or the services are so far away from where life is, that or so overworked where life is. So creating methods to reach to the communities that we work with is what is necessary.
I've spoken about this in another podcast also, the loneliness of city life. You're seeing more and more urban centers. You're seeing rural areas also where you have migrant populations. The men go to work. Like in Bihar, there are many places where they're saying that they are ghost towns. There are just the elderly who are left behind in the villages because the men have gone and the women go away somewhere to the farms to work, and they leave the older parents at home with the children. The women are working in the farm. So you're talking about nobody left in the villages. When you're coming to the urban areas, the homes are too small, so people move out. So you're talking about aging population who don't have that security net, and we saw this especially during COVID times also. जो पहले सत्संग में चले जाते थे या neighborhood walks पे चले जाते थे, sitting in a group, those systems broke down. Somebody like a group of 20 women would get together for a laugh club or something. One person dies in that group bikhar gaya. So increasingly problems of loneliness in aging populations, and what they are saying is that you're getting child psychologists, child therapists, but you don't have problems for geriatrics. That issue is not there.
That in itself is a myth that we're getting more psychologists and more child therapists.
But those who are available are those who are...
There is, let's say, a more visible conversation about some disorders. Like, for example, there will be some conversation about ADHD, there will be some conversation about autism, there will be some conversation about anxiety and depression, maybe OCD, there will be some conversation, mood disorder, there will be some conversation. older people and depression, older people and loneliness, cognitive impairment, dementia. Those are conversations that are not even beginning to start,
Yes.
right? And again, what I'm saying is, people people tell me that because I run three kinds of services. I run a not-for-profit service, I run a corporate mental health service through a hospital, and I run a South Delhi service, right? So so I meet people who are as vulnerable as women who have been trafficked, children in care homes, people in old age homes, people on the streets. Through my not-for-profit, I meet people whose narrative I can share more easily because they come from the same middle class context that I come through, and then I work with people who come to a corporate hospital from Afghanistan to Dhaka, the whole range of people.
And that means conflict zones.
And that also means conflict zones. Through the not-for-profit, we also work in disaster zones.
Okay.
Post tsunami, post
PTSD issues.
So huge issues. So when I see a range of things, people tell me, "Why don't you specialize in one? You would be much more effective if you specialize in one." And I say, one of my teachers, whom I met only for 10 days in my whole psychiatry training, because I trained at PGI Chandigarh, and then you are posted for 1 year to one month to NIMHANS Bangalore. And at that time, the director of NIMHANS Bangalore was Dr. R.S. Murthy, Professor R.S. Murthy. And he said one sentence to me that in India, if you have to be a mental health professional, you have to be a social protagonist. You cannot be only a mental health professional. And that's the reality. That in India, not just me, most mental health professionals have to struggle at the level of a range of people, because the need is so huge. You can't end up saying, okay, I will choose to do this much, because the person who's coming to you will have a father, will have a child, will also come back to you. The community that you live in will have a school which will also come to you. We'll have a university which will also come to you. So what then is, you have to conserve your time and say, okay, I'll work with a team. And then you have to struggle with processes of, for example, credentialing and skill base of psychologists is a huge issue in this country. People with graduation, people with post-graduation are not credentialed sometimes to become mental health professionals. So it becomes an issue then. Whom do you train and whom do you employ to provide services?
So why aren't they done? Why are they not credentialed?
Because
we don't have a system of doing
because again, no, there's a system. Rehabilitation Council of India is supposed to credential psychologists, because mental health also causes disability. But as I have described, there are a broad number of mental health problems which cannot be dealt with by only a disability human resource organization. You need a whole workforce for school mental health services. You need a whole workforce for university counseling. You need a whole workforce. So if IT is a growth area for human resources, or AI is a growth area for human resources, believe me, if we started investing on mental health, for example, one idea, create one ASHA worker extra in a village, link that to Manrega, in a manner that it focuses only on disability and mental health in the village. You've created so many more jobs.
Yes.
You've created a different kind of employment. And you've reached every village. So you have to be innovative if you're going to address mental health in this country.
Yeah, sir, I just wanted to know that there was a NCRT's mental health survey and well-being. It was related that, post-COVID, children are suffering, like 11% are reporting they are getting anxious, then 43% experiencing mood swings, then it is linked to overuse of the internet and specifically social media. What kind of problems you're...
Again, my worry is that unidimensional definition of a problem on mental health will always fail us. Social media is available, right? If you look at my use of social media or your own use of social media,
Yeah.
or जिनका सर्वे हुआ बच्चों का उनके parents' use of social media, people can't stop doing TikTok in the lift. How will
All
you
the
stop your
time.
children?
Yeah.
How will you
Yeah.
stop
Instagram.
how will you stop children from being on social media? Yes, social media is taking us away from some methods of experiencing life. And yes, it is becoming addictive. And yes, it is contributing to some degree of anxiety and depression. But it's one part of the jigsaw, isn't it? Just addressing that कि पीछे पड़ जाओ उसके is not going to solve the problem. What will solve the problem is create more opportunities of conversation and discourses for the child. If one was able to create time to paint with the child will paint with you. If the conversation is only a problem-solving conversation, कि तुमने ये किया कि नहीं किया, ये हुआ कि नहीं हुआ, if the conversation is only a judgmental conversation, a conversation of criticism, the environment which is directive and critical of the child stops. जब discourse होगा ही नहीं तो किसी बात पे बात ही नहीं होगी ना. जब vocabulary of discourse नहीं हो गया, जब
Conversations have become lesser because
Zero.
of... Yeah.
Ma'am, I have seen there was a family, both the parents are most of the time they are occupied and busy with the phone. The child was also like he was going through the mobile autism, virtual autism.
अब मैं autism word नहीं use करूँगा because it's again
The
diluting
spectrum is very
Yeah.
vast
diluting
also.
Yeah.
the word.
Huh.
Yeah, this is what doctor said. Ki maybe he's, but now the child is fine when they started spending time with the child. Earlier, he was the child was completely ignored by the parents and all.
More often than not, the solutions for mental health lie in tweaking the environment as well. Some of the solutions lie in working with the individual. Some of the solutions lie with medicines. But as I'm saying, a large number of things can be done by just communicating differently.
We've spoken a bit about children, about women, and about older population. Let me come to young professionals. Series of issues. One is about the burnout factor. Now there's always this conversation that, oh, we should have 14-hour work days or 18-hour work days or 12-hour work days.
We can,
How do you see this and the productive phase of one's life, which is, I believe it's becoming lesser and lesser for young professionals because companies suck out so much from a professional that the burnout, the years that you are productive are becoming lesser and lesser. So by the time you're 40 in these corporate jobs, you're already burnt out. So what are the red flags that young professionals
40
should
is
watch
too
out?
late.
Too late already?
Too late already because people are having a quarter life crisis. People are having existential worries about what are they doing at 25 now.
At 25, existential crisis?
And also,
heavens.
this whole process of not being able to postpone gratification, not being able to wait for things to come to you.
Yeah.
जो होना है आज होना अभी नहीं हुआ तो कभी नहीं होगा. That is a culture, right? And that is a social demand. And it's world over. It's not just India.
Sure.
In India, it gets coupled with scarcity that we have seen for so many years. Right? So because we've seen the struggles of things not being there, then the fear that things
That
will
you could relapse to that.
relapse to that makes you work harder and harder and harder, and the system makes you work harder and harder. It's a very, very difficult situation to be in. All workplaces in the organized industry should at least have a mental health workplace policy.
Okay.
Right? Just as they have a diversity and inclusion and equity policy, they should have a mental health workplace policy.
Okay.
If they want, link they should think of their employees as mental capital. If they're going to use their brains, then their brains better be effective. Then acknowledging people as people is going to be very important. This whole work from home movement provided people a significant amount of, the one benefit that came out of COVID was that people recognized that life it's not just about work. Although then it got abused to, every bit of your time at work at home was for work.
Yeah.
If we do not have a workplace policy, then the quality of workforce that we will have is going to go down.
Okay.
So I think workplace mental health policy is important. Mental health days are important. Solutions like acknowledging that the health insurance that you provide should include mental health services, providing ongoing mental health services through a third-party resource, not as sometimes these things are done as you're not performing well, go to mental health services.
Or go to HR.
Or go to HR.
HR is supposed to deal with mental health issues.
So the moment you... so I think that two important points. In the wider society, mental health is the operational point of vulnerability. Right? If people are going to become more and more vulnerable, it is because their mental health is not being addressed. In a workplace, mental health can be the operational point of productivity. And if you do address mental health, because you have the capacity to do so, if you do provide resources, but providing mental health, so then your work will become more productive and efficient. It's a organizational development strategy as opposed to a healthcare strategy.
Look, see, for example, you're working in an environment where there are 300 or 400 people at the workplace. You notice that somebody is a little off. The reason could just be that he or she lost a parent. And within 4 days, that person is expected to come back to work and be just as productive.
Right. So
because those are the pressures that we have, because we've got to make sure that our colleague is productive. Because my boss will otherwise complain that my co-worker is not productive.
Sure.
So how does a young professional switch off that trauma of having lost a parent?
No, you can't.
You can't.
And that's why a mental health workplace policy, which does the first thing that a mental health workplace policy should do is to evaluate all the other work processes and procedures to see the mental health impact of those procedures.
So
and
take
policies.
him or her off that high stress work for a week till they... what is the solution?
Have a discussion as to when would it be all right for him to come back. Give people the space to be able to come back in their own time. Believe me, if you do that, you will find that some people will take longer, some people will take... On an average, your organization will perform better if generally it was felt that the organization was empathetic to the workforce.
Okay.
The environment of the organization would change so significantly by being an empathetic organization. So,
but also sometimes the worker himself or herself doesn't want to take that time off or doesn't want to take a less stressful job because they feel that I will be seen as a namby-pamby. I'll be seen as a weak person.
So if the culture is changed and if it is all right to talk about what you are going through, and if it is brave to seek help, if that becomes the narrative of a culture, as opposed to its, men don't cry kind of a culture, or women don't cry now kind of a culture, then you've changed the narrative. You've changed the paradigm on which people are. We have to go back to questioning ourselves, what is the purpose of work? Is the purpose of work to create money, or is the purpose of work to help people build their identities and help people have a purposeful life, have dignity in their life? If the purpose of work is only competing and creating money,
No, not bottom line. I think most companies realize it's not just the bottom line anymore.
Right. So the bottom line
Huh.
is having an empathetic organization.
Empathetic, right. The other thing which I want to also ask you about young professionals is about love life pressures. We've moved from that position where there was that arranged marriage versus love marriage or choice marriage, the problems that occurred. Mostly people have moved. I'm not saying in all strata of society. Abhi bhi you are hearing about all kinds of, parents shooting down, honor killings. Ye sab hote hain. But increasingly in middle class and in upper middle class homes, you're hearing about the fear of rejection. Men not making that effort or women not making that effort to go out and seek a partner. Rather going through apps to see कि अगर ये vibe होता है कि नहीं होता है. So अगर होता है तो okay, then I'll make the effort. So the traditional way of courting a person. So you wore nice clothes, you looked attractive, you made that effort. Maybe you go to a bar or go to a restaurant, look around you, find somebody. Social gatherings. In my generation, there used to be something called jam sessions. I don't know whether you remember that.
I remember.
You remember that, right? Yeah. So you went out and met with people your age, maybe dated a person or two, found somebody. That's becoming lesser and lesser, especially in developed societies. And that is being seen in urban metros also, where the fear of being rejected by a girl or a girl feeling rejected by a boy is so much that you make your circle narrower and smaller. And that makes social incompatibility.
So that is one dimension, that there's a fear of rejection. But there's a lot of experimentation on relationships that is happening. Short-termism in relationships is what I'm more worried about.
Is acceptable, not acceptable anymore?
Short-termism is becoming more and more acceptable
among the youth.
Among the young people.
Isn't that good?
I think...
Heartbreak is not crushing a person to
It's not destroying a person.
It's not, yeah.
But remember, there are layers to the Indian narrative. If this is one story, parallel to this, there are 10 other stories where people are still becoming the Devdas.
True.
Right? So there is a narrative, there are many, many, many layers to each story. In relationships, again, there's a lack of postponement of giving the time for the relationship to evolve.
Okay.
There was a mental health philosopher or mental health expert called Eric Fromm, who said you don't fall in love. You either walk in love or you work through love. You evolve in love. And there are 4 elements, as he described, for love. Care, respect, responsibility, and knowledge. Knowledge being the most important. If we do not spend time getting to know people, we will not end up respecting them or being responsible towards them or being caring towards them. Then we will start just expecting them to be in a quid pro relationship with us. And in that give and take relationship, when we feel hard done by, when the transaction fails, the relationship fails. So this failure of transaction being equal, but thankfully this is changing, that failure of transaction is not being seen as end of the world. It is being seen as a failure of a transaction. Chalo, ye nahi chala to, ye nahi to aur sahi. And that's more contemporary, more
I'm seeing
helpful.
more and more parents accepting that their daughter's marriage may have been a mistake, and it's like log kya kahenge, wapas mat aana. That is changing more and more.
Divorce rates are increasing significantly, sometimes because of the reasons for a lack of compatibility, sometimes for the reasons of violence, sometimes for blaming the other person. Mostly we end up blaming the other person rather than acknowledging that we are different. But divorce rates are increasing in our society. There is no doubt about that. But the divorce still remains to be an acrimonious process.
Yes.
It's not a...
No, the courts in India make it an extremely difficult task. And I guess traditionally they don't want broken marriages or whatever, but it is difficult to get divorce in India.
We continue to be a patriarchal, paternalistic society.
Yeah. So it does happen.
I just wanted to know the availability of over-the-counter antidepressants, sir.
Yes, that was another thing that
Yes.
we've discussed this on the shows with other doctors also, that self medication and easy accessibility to drugs is medication is so rampant in our country. Especially नींद नहीं आ रही चलो कंपोज ले लो.
Yeah.
That thing of पत्ती कंपोज का हर घर में होता है. So
True.
instead of trying to sleep or whatever, I think that's what you
Yes,
meant.
self-medication.
And it's not just sleep medication. Anything now, is very rampant. कि सुबह उठ नहीं सकते तो कुछ ले
So
लिया.
that's another
सो नहीं
reality
सकते.
as a health professional
Yeah.
that one struggles with. That people, one of the most commonly addicting drugs, over-the-counter availability of some drugs, which are addictive in nature, which are harmful in nature, is there's an easy access to many drugs. And while there are rules and laws against that, and things are changing and evolving, and for the better, it still remains a problem. Even a more common problem is antibiotics being used left,
Yes.
right, and center. Even a more common problem is painkillers being used and then kidneys being destroyed because
Yeah.
of that, and a number of people ending up with chronic renal failures because of having used painkillers without thinking. So it's not just psychiatric medicines, it is all kinds of medicines. In fact, psychiatric medicines are slightly more controlled than other medicines. But this is a reality of our country which needs to change. That while the real access to healthcare is not there, but you can get investigations at a drop of a hat.
Yeah.
Without a prescription, you can get medicines without a prescription. You can go to 5 different doctors and get 5 different opinions at a drop of a hat,
Yeah.
thus clogging up the system. Because the negative effects of self-usage will then lead to more problems, which will then clog up the healthcare system even further.
Especially anxiety, I have seen that most people say हमें anxiety है and उसकी मासी ये लेती है anxiety के लिए, फलाना का चाचा ये लेता है anxiety के लिए. So without going to a doctor,
For
take the
years.
medicine.
Everyone
For
is
years.
doctor.
Yeah.
Everyone is doctor.
कि चाचा के मौसेरे भाई ने क्या किया था उसका अभी मुझे रिस्पांस मिल जाएगा.
हाँ.
Again, as I said, this is a mindset that is changing.
You are noticing a change.
People are careful, but people are also not careful. So there are a number of people who end up using medicines. But even one of the things that we haven't talked about is alcohol and
Yes.
smoking. And those are increasing in numbers as well, and those are significantly easily available.
Not social drinking, but abuse of alcohol.
People who so the reality about India is that people drink to get drunk. People binge drink and they get drunk. The percentage of people who become addicted to alcohol amongst the people who start off as social drinkers is higher in India, and that's again a cultural trend. And younger people are drinking, and more women are drinking. And it is becoming more and more of a problem because it ends up destroying many other systems in the body.
Yeah.
And of course, there's the use of, addictive use of cannabis. There's the addictive use of opiates. All those addiction behaviors are definitely increasing.
And you're seeing a significant rise in these?
In some pockets of population, it is being seen as a stress buster to use some substances. And
Is it there in the middle class, upper middle class? Where would we see it in cities?
Across the board. For example, many young professionals, I won't say most, many young professionals that I meet are using alcohol regularly. If not using alcohol, they're using other substances regularly. And there's almost a normalization and an expectation that to have fun or to bust stress, these are easy things to do.
To cope?
To cope or enjoy, one of the two.
Okay. I would say just go for a cheesecake. Why?
Which
You
also
take it
clogs
as a
your
stress
arteries.
buster.
But still, it's not killing me. Maybe in the long run, everything will kill you.
Yes.
But yeah.
still.
Doctor, another thing is about, we read this a lot and it will come up again by October. We'll we'll have n number of studies which are being quoted in our newspapers about how pollution is affecting mental health, noise pollution, air pollution. So could you talk to me about that? And so that before we come to the Parali season and before we come to the whole Delhi becoming a
So climate
thing.
change in general is affecting mental health. Heat also affects mental health. Pollution affects mental health. The fear about what pollution might do, what climate change might do to us affects us. So climate change in itself has a significant, so the amount of rage and anger outbursts that would increase in a heat, the amount of depression that would increase in heat. For example, flooding. We recently had, a breakdown of when the first rain happened in Delhi. The amount of stress that generated in the whole system and the amount of mental health impact that would have had would not have been even
Really?
thought of. We think of it as chal raha hai, ho raha hai, chalne do.
But that's Delhi, no? Delhiites will
Precise.
stress over everything.
Right.
No rain, too cold, too much of smoke.
So what we forget is that it affects livelihoods of people, thousands of people, and those affected livelihoods then affect the education of those people.
Yeah.
And what it affects is then it affects their self-esteem. It affects हमेशा ही ऐसा होगा तो मेरा क्या होगा. It affects the desperation that people feel, and that contributes to further coping mechanisms that are not helpful.
Okay.
So there could be a ripple effect, which is not just like a butterfly flapping their wings and then having an effect. It's so much. The domino effect is so much more real and in your face that it worsens the outcomes on mental health.
Okay, so these, if you could just bust these myths for us, whether it's true or false, mental health issues result from personal weakness. This is what many people are told.
It is false. Mental health problems are common. They can happen to all people, most people, people who solve problems well, people who have the skills to express their emotions could also end up having mental health problems. Mental health problems are not related to personal weakness.
The other one we have is depression and anxiety are most common mental health conditions, are they?
Depression and anxiety are very common mental health conditions. They're called the common mental health disorders. But other conditions that are also common are obsessive compulsive disorder, mood disorders. Schizophrenia is not as common, but depression and anxiety are the commonest psychiatric disorders that we find.
And what is the red flag that this I cannot resolve with yoga and with watching a movie? I need to see a doctor.
So if you have a change of mood that has lasted for a significant period of time, let's say more than 2 weeks, 3 weeks, and if you have lack of interest and you're unable to enjoy yourself and you're feeling helpless or hopeless, if you have had any of these symptoms for a few weeks and talking about it to friends and family has not helped, it means, and your sleep and appetite are getting affected, it means that you could be facing a depressive disorder. It is important to go and seek help. If in anxiety, you're always apprehensive, always on the edge, predicting catastrophes, anticipating problems and trying to solve problems all the time, avoiding things, having panic attacks, and this is happening repeatedly over a period of a month or two, please go and seek help. Don't sit on it. Don't go and buy the next medicine from the chemist because your Masi's child had it. Go and seek help.
Okay. The next one is mental health disorders can be diagnosed with one appointment. This is another thing that एक बारी में क्यों नहीं डॉक्टर बता सके कि प्रॉब्लम है कि नहीं है.
So some mental health problems are diagnosed with a single appointment. Normally, people will go through a process of talking to the person, understanding the person, their problems, their context, maybe ordering some physical investigations because physical disorders can contribute to a mental health problem. Also ordering some psychological investigations because those are necessary to quantify what is happening, maybe talking to the family as well. So it might take 1, 2 or 3 or 6 sessions.
What's the best thing to do? Should the patient come alone? Should the patient come with a family member? how does
Whatever
it
the
work?
person feels comfortable with.
Okay.
Ideally, it is useful to have somebody else also narrate the another perspective about the person's problems. But the mental health professional should be careful that the primary narrative is the person's narrative, and other people can have assumptions about them. But it sometimes is useful to go to a mental health professional with someone, because you might start feeling distraught. It's not that you come to a mental health professional and go out feeling good about it.
Yes.
You could have opened up parcels of memory in your brain, or experiences in your brain, which might have brought back difficult experiences to you. And you might need support at that point of time when you get out of that session. So initially, it might be useful to come with someone.
Okay.
If you can. Otherwise, don't wait for someone to just come.
Mental health problems in children are usually just phases, which you were talking about, Shalini,
yeah.
that there was an issue and it got resolved when they figured out.
So remember the classification that I said: mental health needs, mental health problems, mental health disorders. Right? Some phases might be phases, but when is it a phase and when is it a disorder? You can't prejudge that. A professional is necessary to make a distinction between whether it's now a problem. So whenever the problem has lasted for a long period of time, whenever the distress is high, whenever it is leading to a dysfunction, either of communication or of a routine or of education, whenever it's leading to dysfunction, it is useful to check things out, not just call it a phase. Because I've seen people say it's a phase for 20 years and say it's a phase that he was going through. Delayed treatment means that it takes longer to get better.
It's also, one has seen that, say at puberty level or just after puberty, if the child is showing a sexual orientation which is different, then it's considered ये तो अभी ये phase है इसका, ठीक हो जाएगा ये थोड़ी देर में.
Sexual orientation is not a disorder.
It's not, yes, but it's seen as a disorder in many families, that ये disorder ठीक हो जाएगा.
But we have to continue to clarify to people, educate people that it's not a disorder, it's not a psychiatric condition, it's
who the person is.
Who the person is. It's the identity of that person. The person might explore, discover, experiment, and you do not have to be informed about each experiment a person does with their identity. That would be too intrusive, even if the person is your child. So it's important to clearly say sexual orientation should not be seen as a disorder.
Right. Genetics, do they influence the development of mental health disorders?
There can be a biological basis for
like if there's
mental health
bipolar
problems.
disorder in the family history of
many psychiatric disorders run in the family. More often than not, for example, obsessive compulsive disorder, anxiety, depression, bipolar mood disorders, schizophrenia, in varying degrees, various genes are involved in defining the vulnerability. We still haven't been able to find one gene candidate for one illness in psychiatric disorders. That's not going to happen for some time because they are multifactorial illnesses. They happen because of some genetic disorder which will cause some metabolic changes or some mitochondrial changes or some biological changes, some neurochemical changes in the brain. That coupled with stress and experiences of a different kind, of a repeated kind, could precipitate a disorder. So not everyone who has a parent who has a disorder will end up having the same disorder.
Okay.
Some percentage might, given how life evolves for them.
Okay. These are the things which I want to say. What not to say to a person with mental health issues. It's all in your head. You're imagining it. Yes? Shouldn't say it?
If you say it, then you need to learn more about mental health because when you're going through a mental health problem, it is one of the most difficult and traumatic experiences that you're going through. Saying that you're imagining it or it's all in your mind does not help. Getting irritated with the person, getting impatient with the person does not help. Be kind, be listening. You may not agree with the person. You don't have to always agree with anyone. But be kind enough to listen to them and their point of view.
Empathy. Okay. Another thing which is often said is, come on, snap out of it.
Pull your socks and get out of it.
Get out of
Go
it.
for a vacation,
Yeah.
let's have an ice cream. More important than that, saying, I'm here to listen. Please tell me if I can at least help you by listening to you. Check in on people. Ask if you can help in any way. Remember, if you're depressed, for example, or if you're anxious, snapping out of it is the last thing. It's like asking somebody with a fracture in the foot to run a 100-meter race. Would you do that? No, you wouldn't do that. So somebody who's feeling helpless and hopeless about life, asking them to snap out of it, they know that they need to snap out of it. They can't.
They can't.
Because biologically and psychologically and socially, they are triangulated at a point in their life where they're feeling overwhelmed and paralyzed. Saying I'm available to seek to help and listen is going to help them much more than saying snap out of it.
Snap out of it. Okay. The other thing is that everybody has a solution to somebody who's depressed. Do yoga, see movies, Kapil Sharma ka show dekh lo, has loge. Not that it doesn't. I know there are many people who are sitting in hospital, they're caregivers, watching a funny show or going and eating an ice cream does resolve that momentary extreme feeling of helplessness. It does. But it's not a solution for depression. I would think that. But you tell me.
Right. So trivializing somebody else's pain by comparing it or by offering an easy solution just because the solution worked for you.
Yeah.
It might have worked for you to have an ice cream or have salted peanuts or whatever your choice might be. It might have worked for you.
Yeah.
It might just make the other person feel even more helpless. कि ये इतना आसान है फिर भी मैं नहीं कर पा रहा.
Correct.
Imagine other people are able to get out of it. I'm not being able to get out of it. You're making that person feel even more kind of decimated about their experience. You're denying that person the chance to express themselves by saying this.
Okay.
So be around, don't be intrusive, check with the other person as to what they want to talk about. Don't offer easy solutions. Maybe creating opportunities to participate in life, being around to help people participate in life in a gradual way at the pace that they want may be helpful along with the other things. But just saying, here's the opportunity, here are 2 tickets to go and do this is not going to solve their problem.
Okay. The other one is that very often, and parents do this very often, when children complain or children express, sense of helplessness, you have a good life, उनको देखो वो झुग्गियों में रहते हैं, फिर भी देखो smile कर रहे हैं. What are you complaining about?
Right. So comparison of problems. Everybody's problem is a pain that they know how difficult it is. I would not compare people's problems. I would also not wish poverty on anyone.
Yeah.
Poverty is very, very traumatic and difficult. To say that poor people are happy. Everybody has the capacity to be happy within the circumstances that they live. But I would not wish poverty on anyone. But I would not also compare people's problems. Because by doing so, again, I'm being ruthless. I'm scraping the wound. I wouldn't want to do that to anyone.
Yeah. The other one is that, people not recognizing that OCD, which is the obsession, is something which needs help. Everybody says, oh, dekho Monica in Friends. Remember that serial Monica? She has OCD. She keeps cleaning. So cleaning something or being obsessive about being on time or somebody comes late, you get upset about it. Upset to the point of, weeping or getting angry as to losing your cool. Those are obsessions.
So ADHD and OCD are the most commonly thrown around diagnoses, and they're also the most commonly missed diagnoses. When we arrive at a psychiatric diagnosis, we are looking for a cluster of symptoms, not just 1 or 2 symptoms. We are looking at whether they are causing distress and dysfunction as well. Having repetitive thoughts which are intrusive in nature, which are linked to anxiety, which your anxiety is being managed by doing repetitive thoughts or behaviors, is obsessive compulsive disorder. If you are doing things in a repetitive manner and it is causing distress or dysfunction, if you're procrastinating, if you're having anger outbursts, please do seek help for OCD. But just having one or the other symptom, having one repetitive thought or the other, having one behavior or the other does not make a diagnosis. Many people have their own ways of doing things. Just having one particular way of doing things is not a diagnosis. But if it is coupled with many others, especially if it is causing distress or dysfunction, must be considered.
I have seen, matlab, there is a comparison also, like, ये मुझे अभी चाहिए, I want this at the same moment. I have seen people, इसको तो OCD है, they take it for granted. So they require a treatment.
So let me kind of break that into parts because उसमें ना 3 statements हैं जो कि फर्क है कि some people with obsessive compulsive disorder can be inflexible and have a very strong sense of moral right and wrong. And if then that is coupled with other things that I was talking about, then again an assessment and treatment for OCD is. But using OCD as a pejorative term, as a abusive throw at somebody, that is again disempowering people. That is not what will help. कि ये तो सुस्त ही रहता है, ये तो डिप्रेस्ड ही है, ये तो उदास ही रहता है, ये तो ऑब्सेसिव है, is a way of isolating people and stigmatizing them further. It will harm anybody. Even if they don't have a problem, it will harm them. If they have a problem, it will harm them. It will harm you as a person if you judge people so much. Because if you're so critical of people, then how would you feel happy about what is happening in your own life? You'll become critical of yourself as well eventually.
But can a child who has ADHD, who's been diagnosed with having a certain disorder, is it possible to bring them out, or is it something that will reoccur in adulthood too?
Some children, some percentage of people with childhood OCD continue to have OCD in adulthood as well, and we continue to need treatment. Some people will settle down and not have the disorder continuing. That there's a percentage on that. I again don't want people to start worrying that ADHD is a common diagnosis, right?
Yes, that's what.
And sometimes just changing the method of helping the child focus and concentrate helps. Sometimes when the problems are more, medicines help. Sometimes it stops evolving after a certain age. Sometimes it continues into adulthood. The nature of the medicine might change, the psychological treatment might change, and they might need more longer-term help. Just because of the worry of long-term help, not seeking help is not a solution.
Not a solution.
Because then you are allowing it to fester and grow,
Yes.
which is not very helpful.
And this is a major problem.
Okay. Another thing which happens is, why do you want to see a doctor to tell you to eat less? This is about, whatever, body shaming that happens, bulimia, anorexia, all these things. Why do you want to see a doctor to eat less? Can't you look at the mirror and know that you have a problem? तो डॉक्टर के पास जाने की क्या जरूरत है?
So again, obesity is a nearer to home topic.
Yeah, all of us have to battle with health issues like that.
So it's very difficult to change your body weight, right? First acknowledgement has to be, it's difficult to do so because many a time there are genetic predispositions for obesity as well. There are lifestyle predictions that you've learned over the years. So it's not easy to lose weight, and shaming people for being a particular body shape or a particular weight is not helpful. Helping them recognize and helping them reward a healthy lifestyle, helping them work towards with their permission is useful. Sometimes, many a time, to see whether there are any endocrinological basis for the weight, to meet a psychologist for eating disorder patterns, lifestyle patterns that you can change, meeting a nutritionist for a correct information on diet. Most of us are ill-informed about diet. most of us eat more carbohydrates, eat less proteins, and do little exercise.
Yes.
And it's very difficult to get out of those methods. Again, what I find about obesity is that it's an industry that everybody wants to be a part of, and everybody wants to then give advice. And most of the advice is actually layering the myths further. Most of the advice actually does not work because people give up on themselves too soon. So motivational enhancement to change one's lifestyle, to become a better, healthier lifestyle is what I would focus on rather than just reduction of weight.
I have seen, sir, that if a female is eating more and more, the diet has been increased suddenly. The people say like डिप्रेशन है इसको, तो ये बहुत कॉमन है, डिप्रेशन है, इसीलिए जब भी फीमेल ज़्यादा खाए तो इट्स लाइक कि डिप्रेशन में है.
आपके दोस्त बहुत पता नहीं कैसी कैसी बातें सुनाते हैं.
True, very true.
But these are myths again. There are a million myths about mental health, but it boils down to, again, people thinking of people with mental health problems as either incapable or dangerous. It boils down to those two assumptions. And each time we have an opportunity to challenge such a myth, we should challenge such a myth. Everyone should challenge myths about mental health, because just the doctors doing so is not going to work, because all of us hold myths about mental health, which causes further stigma. I can do an experiment and tell you, for example, there's a person who comes and you have a paying guest accommodation, and this person comes to you and says मुझे चाहिए, and पर मुझे ना कभी कभी आवाज़ें सुनाई देती हैं. आपको लगे ठीक है, कोई फर्क नहीं पड़ता, मैं तो लिबरल व्यक्ति हूँ, मैं दे देता हूँ किराए पे घर. The next thing that he says is, I have got a PhD in maths, I can tutor your child if you want me to, I have time. आपका मन क्वेश्चन करेगा नहीं करेगा कि अरे मेंटल हेल्थ प्रॉब्लम है, ट्यूटरिंग के लिए भेजूं नहीं भेजूं.
हाँ,
बिल्कुल बिल्कुल.
So आपकी assumptions ट्रिगर होनी शुरू होगी ना कि मेंटल हेल्थ वाले लोग डेंजरस होते हैं. उसने तो कुछ ऐसा बिहेवियर शो नहीं किया, उसकी तो कोई ऐसी हिस्ट्री नहीं है, वो तो ऑफर कर रहा है, आपको हेल्प कर रहा है. सो पेइंग गेस्ट रखने के लिए भी आप में क्वेश्चन दिमाग में आ गया, ट्यूटरिंग के टाइम पे भी आ गया. आप सोच लें कि दिस इज यंगर मैन और यंगर वुमन एंड यू हैव एन ओल्डर चाइल्ड एंड दे आर इन अ रिलेशनशिप एंड योर चाइल्ड कम्स एंड टेल्स यू, गर्ल और बॉय, वी आर गोइंग अराउंड टुगेदर. अब माइंड क्या बोलेगा? रेड अलर्ट कर देगा अब तो, कि अरे मेंटल हेल्थ प्रॉब्लम है, रेड अलर्ट ये कैसे हो सकता है. So assumptions हम सब carry करते हैं.
True.
I'm just trying to demonstrate that through this example. So myths हमारे को अपने लिए भी challenge करने हैं.
No, but what Shalini was saying about women doing
Overeat.
this. Yeah, but it is like, you remember that film, Dr. Saab, Dil Dhadakne Do, in which the protagonist, this girl, this lady, she knows her husband is flirting with other women. She doesn't know how to deal with it. She supposedly has a very happy life. So she eats this
I intentionally did not
muffin.
respond to that.
Right.
It's
You know,
because-
she eats this muffin out of depression.
No.
Stuffs it.
I intentionally did not respond to that because this example is loaded with stereotypes about how women cope with mental health problems, right? Those stereotypes are about gender as well.
Like men will go to alcohol, devdas ban jayenge,
Right.
kind of a thing.
So those stereotypes need to be challenged again. Everybody deals with their mental health problems differently. Some people do focus on eating as a mechanism to cope with stress. Some people do something else. Some people watch TikTok. Some people make TikToks. Some people become psychiatrists, for all you know. People do different things to cope with what they have experienced. So to label a person and then stereotype it is not a very helpful thing to do. And as I said, we need to continue to challenge these and not participate in furthering these mental health.
Yeah, okay. So don't, if somebody jokes in that manner, don't add to the joke. Is something we have to guard against,
Yes.
Like sometimes you use words which could be harmful. Like, okay, another thing which people say is stop watching reels you will eat better. In the sense, wo jo cooking ke jo, I remember during COVID, everybody was making banana bread. And then there were Instagram reels on that, and there was Twitter was all about it. So more and more people getting into cooking and eating because there was nothing else to do. So it was like, don't go on social media, don't see Facebook, fir aap, you'll keep eating.
Right.
That's another thing.
And if not eating, feeling jealous about people who can do the hook step on Toba Toba.
Yeah, the feeling, it's everything, no? It's like, my skin is not looking as good because so and so, and I'm not getting enough vacations because everybody on Instagram is going on vacation.
Right. So the FOMO thing.
Yeah.
I think excess of anything is going to harm you. I think if you're what it reflects is that we all want ways of diverting our attention from what we've been focused on through the day to something that allows us to not be involved in problem solving. Again, we'll choose the method that we want. So watching reels could be one method, but diversify that method and you will enjoy it more.
And another thing which people tend to say, if somebody comes to you to say that I'm feeling depressed, immediately giving the advice, try to be positive.
Right. And my answer to that is, if I tell you, for example, to do or not to do something, for example, if I say to you, don't think of a black cat right now, what's the first thought that comes to your mind?
Don't think of a black cat right now. The first thing is the black cat.
Right. So if you say to somebody, don't be negative, be positive, the first thing that will come back is a negative thought. So rather than saying that, again, go back to, you seem to be going through a tough time, do you want to talk about it? And that talk will help them think differently.
True. Another thing which people say is, or even I felt suicidal when I was your age. Most students feel like this at the time of entrance exam. Ye to common feeling hai.
So again, if you are doing this as a way of creating a sense of identification with what the person is going through, then your language will be slightly different. But here it seems that you're trivializing what the person is going through by saying it's average and normal. जिसका दुख उसी को पता होता है कि क्या हो रहा है.
There was, I think that term is not here because I had written down the other thing. It's that anybody who says that I think there is something wrong with me in the family, the fear is the pushback that tu mental hai kya, tu psycho hai kya. Those terms, which are the terms which are absolutely wrong and should not be used when a friend or a family member comes to you or you detect that there is a problem.
I think more important than labeling and name-calling somebody through pejorative psychiatric or mental health terms, it's important to be watchful about our language generally.
Okay.
That's why if you've seen, I've used the word people living with mental illness all through, as opposed to mentally ill, as opposed to schizophrenic, so people living with schizophrenia, people living with anxiety. If our general way of looking at mental health becomes it's a universal need,
Not as a victim.
and not blame the person for their experiences. We end up blaming the person for their experiences.
That you invited it.
Right? So the common thing is blaming a fat person for eating more, right?
Yeah.
Calling them fatty or calling them something else. Mental, MR, common words which we throw around as friendly words.
Yeah.
They need to go out of the friendly parlance. They need to be red alert words which are hurtful to other people. And I'm not being woke here. I'm not saying you always have to be watchful of what you say amongst friends. But remember, by saying something, if you categorize a whole group of people
Yeah.
as a label, you're invisibilizing them. You are pushing them down a ladder which they can't get out of.
And it's we've had a culture of that, and to get people out of that, if you even suggest it, there's such a pushback, like kalua, motu, ganja. These are terms which are used like a endearment also. कि अरे गोलू है ये हमारे घर का गोलू है, हमारे घर का मोटू है. It's said it like, but it's a stigma that stays all your life. In that,
Sure.
it doesn't. They don't come out of it, so it's very hard to change that thing in families. That's what I feel.
And that's why education and our conversations at home, well, again, not getting time to converse at home about diverse things is what needs to change. Our education system needs to move away from only examining about 10 facts about oceans and 5 facts about and some project that you buy from a Aurora bookstall and submit. And,
सोलर सिस्टम का मॉडल बनाओ.
so-
अभी भी वो होता है.
So we need to move away from those conversations to conversations about diversity, to conversations about how other people feel, to conversations about feelings. We need to start thinking of people as people. And unfortunately, we are doing less and less of that.
I have to ask you one before I let you go, about parenting, how we bring up our sons different from our daughters. I read, I read something in which an actor said that हम अपने लड़कों को 6-7 साल में माँ से अलग कर देते हैं. And as a result of that, जब पहले तो बच्चों को अपने साथ सुलाते हैं, we are connected. उसके बाद उसको अलग कर देते हैं. The daughter stays close to the parents. So the daughter वो रोती भी है, वो हंसती भी है, वो माँ को अपनी दुख सुनाती भी है. लेकिन लड़के जो हैं वो दूर होते जाते हैं, in the sense that they are not allowed to speak about their feelings. It's considered less of a man. So a man doesn't cry, a man doesn't talk to his mother about his feelings. So हम लोग अपने लड़कों के साथ, अपने बच्चों के साथ अलग upbringing करते हैं.
So brings us to the question of masculinity and how we define it. And it starts very early on. I have a nephew and niece who are twins, and they're young people doing in their professions now. But when they were young, one day, Subroto Park, Air Force Auditorium, there's a garden there. There was a wedding that we'd gone to there. So both of them were running around, and Meher fell, and Abhi ran up to her, and her frock had gone up, and he pulled the frock down and said, "Don't do it like that." Now, he is coming from a gender-informed, sensitive family. But at 3 years of age, he is becoming the protector. 3 years of age. So, men have to carry this tag of being a protector for a very long time in their life. Men are not understood. Men do not get that space to be understood, the space to express themselves. Men experience violence outside their homes significantly. Men do not have a space to come back and talk about that violence because they will be less of a man if they talked about that violence. Men experience sexual abuse as well.
Yes.
But they're not able to talk about it. So that we treat our children differently, and we give them the roles of being boys being the protectors, and women being the vulnerable. One creates more, a protector can also be the perpetrator.
Yeah.
We are creating that hierarchy. We are also creating a language of iniquity then.
Yes.
A protector needs to be protected to protect.
And he can't be vulnerable, because how do you be a protector if you're vulnerable? Right. That's also there.
And the language of iniquity, the resources are divided in an unequal manner. Yeah. Emotional resources are divided in it. And our conversations then bifurcate. कि कार्ड्स और गन्स की कॉन्वर्सेशन बॉयज के साथ करनी है और डॉल्स और उसकी कॉन्वर्सेशन.
And pink and blue, sir.
All these are stereotypes which are again the conversations are different now. They are being challenged. But largely, there is a societal need to perpetuate the concepts of masculinity that are not helpful.
I wanted to ask one very personal question, sir. If you go to the doctor for some treatment, they will give medicine like stone हो गया कुछ हो गया. But आपका जो subject है ना, it is like आपको बहुत intensely, बहुत micro किसी patient से पूछना. Does it impact your own personal life?
To say that a psychiatrist is not a human being will be foolish, wouldn't it? But one or mental health professional is not a human being. One gets affected by each conversation that one does, but one learns through our training. That's what we are taught as to how to look at your own feelings as separate from the experiences of your patients. That there will be identification from time to time with your patient. For example, in 2003, I lost my father. At that time, a few weeks from after having lost him, I was meeting somebody who had also lost their father. Of course, I would identify with that person because we have had the same experience. But I need to be able to deconstruct that. I need to be able to dissect that feeling that I have versus the feeling that my patient has. And I need to be able to have an avenue to be able to talk about my feelings and my experiences in the therapeutic situation somewhere. And if I don't get that opportunity, because as you grow older in leadership positions, you don't get opportunities, not in just my profession, but in any profession, you don't get opportunities to talk about what you're going through.
True.
In your experiences in that profession. So that's why it's important to have a peer network. That's why it's important to continue to talk, continue to learn, continue to research, and sometimes use younger people to be able to talk about, younger people in your team to be able to talk about what you're going through. Because by doing that, you're creating a role modeling process where they can talk about what they are experiencing. In our team, we have a peer supervision process. We have a debrief process. If we have gone through a difficult experience during therapy, where we have become angry or somebody has become angry, somebody has become too dependent or we've become too emotionally connected to the person, you go back and talk about it, debrief and peer review processes. You have to manage it. And you have to learn to manage it without resorting to 2 extra pegs of alcohol at night.
Yes, because medical practitioners,
True.
and we saw that even during COVID times, they were under such severe stress. And so many people, I mean, I know of many practitioners, medical practitioners, physicians, even abroad, who couldn't take the stress during that COVID period because the stress busters which were available to them, which was family time and all, they didn't have access to that. They couldn't cope with it.
Again, look at the construction of this argument. I'm sorry to point it out.
Not at all.
They could not take the stress because we expected them to take the stress.
Yes, because they're doctors, right? So,
We are human beings like anybody else, and we are, believe me, I would see about 25 to 30 people a day, from a young child of 8 years old coming and crying about a depressive disorder to a 92-year-old person with dementia whose family is just exasperated. In one day, I would go through a range of these
yes.
diagnoses and life experiences and narratives. If I'm not stressed, I would not be human. If I'm not exhausted, I would not be human.
Yes.
But I need to be able to have my own methods and space of being able to delineate this belongs to me and this belongs to what is work for me.
Yeah.
Although I cannot be so
Compartmentalized.
so far away from my clients' experiences that I can't be empathetic. ऐसा तो नहीं कर सकता कि I have to switch myself off each time I listen to people. I have to be actually present emotionally for them, but I do not have to be the knight in shining armor and solve all the problems in the world. I can't. Nobody can.
Well, we all imagine our doctors to be knights in shining armors because you give us hope. So, On that note, thank you so much, Doctor, for spending time with us and explaining these concepts to us, and wishing you all the best from us.
Thank you. Thank you for having me here.
Thank you.
Thank you,
Thank
sir.
you.
Thank you for watching or listening to this edition of the ANI podcast with Smita Prakash. Do like or subscribe on whichever channel you have seen this or heard this. Namaste. Jai Hind. Click here to watch the previous episodes.